you are my last patient for the night. If I can just give this to you really quick, we'll get started. Just want to make sure that all this information is correct. That's your name, and that's your address, and then all your medical information as well. Oh, your name. Right. It's okay. Just let me change that really quick. So you said with an E? Spell with an E, right? Okay. Perfect. Alright, well, if everything else looks good, I will go ahead and get started for you. So, my name is Dr. Dillon. I will be taking samples from you today and observing them with a microscope, just to check if there's any abnormalities or anything we should be concerned about. Before we get started, do you have any questions? No? Okay, awesome. Let's get started. I will grab my gloves to start us off. Just so I don't contaminate. Okay. Wonderful. Just writing a few things down before I get started so I can make sure that everything goes smoothly and we don't miss any steps. Perfect. Okay. So, I have some tools here that I'm going to pull out and just start taking some samples from around your face area. I will get into your ear. I will ask you to open your mouth further down the line. For now, we're just going to start with the outside of your face. So, I'll grab this tool. And I will grab some tweezers. And I will grab a second pair of tweezers. And that looks like everything we'll need for today. Okay. I'll start off by grabbing a few hairs from your eyebrows and from, or just around your face. If that's alright with you. It is while you're here, of course. Okay. Hold still. Okay. Okay. Other side. Perfect. And then a few more. Perfect. Okay. Now that that's out of the way, I'll put these to the sides. Now, the important part here is now that we have the hair, I'm going to start to scrape it just gently with this metal tool. And I'm going to take some samples from the outside of your face, okay? So let me know if anything hurts, if anything's painful, but I'm just going to do that. Okay, hold still again. Okay, awesome. Other side. Perfect. Okay, that's great. You're doing good. You're doing great. Okay, now I'm going to just quickly enter that into the computer, make sure that that is all covered, and we can start the next process. So, just wait one moment, please. Okay. We can start on the second process, which is going to be cleaning and taking samples rather from your inner ear. So I have here some swabs and some drops as well to sort of loosen up any samples that we will collect. So if I can just get you to hold still while I put these drops in your ears. All right. More. There we go. Okay, other ear. Hold still. There we go. All right, good job. Now, while that's still wet, I'm going to quickly take some samples here. Okay, again, hold still. Okay, other side, well, I'll use a different one for the other side of your ear, the other ear. Perfect, that's a great sample. Okay. And I actually have a third one for your mouth, which I will do right now, okay? So if I can get you to open wide, please. Yeah, open wide. Perfect, okay. I'm gonna go on your right side here, good job, and your left as well. Good job, okay. You have nice teeth, by the way. I don't know if anyone's told you that recently, but they're white. You have very nice teeth. Okay, we have the samples now. I will begin the process of preparing these samples and putting them on slides and running them through the microscope. Once I do that, I will see what I can see, and if there's any abnormalities, I will inform you about that, or we will send off the samples for secondary screening in another lab, okay? So, excuse me while I grab my microscope really quick. Alright, now bear with me while I plate these samples, okay? We will start off with the hairs that we have. I'm just going to take some, put them on there. Okay, perfect. I'm going to put them into the microscope. I'm going to take a look, okay? Alright, that one looks pretty normal. I can see the hair follicles. There doesn't appear to be any like mites on your hair follicles or any abnormalities in the surface of the hair. So that looks all really good. Next, I'm going to get your ear samples, okay? Just gonna plate these, or put these on the slide really quick. Perfect. Same thing. Okay. Right now I'm seeing what I'm supposed to be seeing. Yeah, everything looks pretty normal. It's a very clear, greasy consistency, but that's what we want to see from earwax. So it looks good so far. Okay. And I will work on your mouth as a final sample. let's see what I can see here. Yeah. Okay. Okay. I can see some bacteria, and that's not a bad thing. No, it's not a bad thing. You made a face. We're like, oh my god. No, I see some bacteria, but that is completely normal for your mouth, because you need bacteria in your mouth. There's a lot of good bacteria in your mouth, and it's a very prosperous microenvironment for these microorganisms. Totally normal. I don't see any harmful bacteria. They're not in large colonies. It really is standard and in the status quo for what we normally see for mouse samples. All right, well, that was pretty easy. Everything seems to be going all right with you. I'm gonna move this to the side and we can finish up our testing. Okay, I will take these and dispose of them. And I will take these, and these will get sterilized entirely. These will get sterilized entirely, so there's no need to worry. We don't reuse dirty tools on patients. That is not what we do here. And I will just triple check to make sure that all my notes are in line, okay? So bear with me for a second. Yes, you can go on your phone. Yeah, while I'm doing this, you can go on your phone, don't worry. Okay, so that concludes our sample testing. I will not send off any of the samples to an extra lab because everything seems normal to me, in my expert opinion, and we don't want you, to have to wait for these samples to come back and be wondering, and then have the results be just normal. So, yeah, you know what, that was, you were my last patient. I was nervous and worried that this is going to be an extensive session with you, an extensive appointment. It was not. Everything seems to be growing great within your body, on your skin, in your ears, in your mouth. You look great, obviously. You look very healthy. You are very healthy, obviously. I have nothing further to add. Do you have any questions at this point? No? All right, perfect. Well, I'm gonna quickly enter a few last things into the computer, and yeah, you can get on your way, okay? Because it's getting late. All right. So give me a second. Okay. All right. Well, that was your appointment. I will say, if you have to come back for any reason, feel free to call our office. We can schedule in, hopefully get you in somewhere. Times are very busy, but hopefully we can squeeze you in somewhere. Yeah, you're a lovely patient. Yes, you were. Thank you.